The product that we developed in Manchester, which was the night repair therapy, under another company at that time, which is now part of the Skin Diary, contained a variety of products, including the bilberry, as we've discussed. Trialled that on the Manchester Assay, where we presented this at scientific dermatology meetings. We published it in a scientific journal, peer-reviewed paper. It repairs sun-damaged skin. And it will probably improve, and almost certainly would improve, intrinsically aged skin as well, because there are similar deficits in intrinsically aged skin, as you'd find in photoaged skin. And then we did a clinical trial. Volunteers were using it topically, and we showed that there was improvement as well. So it's not just under that sort of rather contrived conditions under the microscope. Clinically, you can see a clinically discernible benefit. So, and it was, I guess, a brave thing to do, because one doesn't have to do a clinical trial as one would do for a new medicine for high blood pressure, for instance. You don't need to do that for an over-the-counter topical product for aging. Mm-hmm. But we did that because you want to have the highest level of evidence possible, which is a controlled study.
Yeah, let me break that down a little bit. So basically, what we normally have is we will have people saying 8 out of 10 people said my skin looks so much better. Then we'd have what happens in a dish where we can say, okay, this showed a little bit of a change. Yeah. But you actually took biopsies and histologically showed that there was an improvement. Yeah. Is that what you were doing?
So we did that, showed that under the microscope there's incontrovertible improvement. And also we did a clinical trial where some individuals used the active product, the night repair therapy as it now is, and just an ordinary cream. There was a discernible difference between the two.
But not only that, they actually compared the night repair therapy to tretinoin on biopsy. So that, if the human trials were brave, then that was probably, a bit crazy actually to try and do that.
Yeah, and I think that we did do that because that's the gold standard, and that's the positive readout, and it worked as well as that. In fact, it was a little bit better. I hasten to add, because in that patch test study, the Manchester Assay, in the short time course that the retin-A is applied to the skin, you don't see increase in collagen. We found an increase in collagen production with the night repair therapy. We found the increased fibrillin and elastic tissue, but this was different, which was really very exciting.
Over what period of time?
This is only a matter of about 12 days.
Wow.
But it's under occlusion, so it's driving it into the skin. But it's making a difference. It's showing it's different from just using an ordinary cream, a sort of a moisturising cream.
So this is kind of revolutionary for us, especially as dermatologists, because we're always being asked by people to recommend night creams. And we kind of just have a few that we rattle off, the ones that we think are probably good because they've got some evidence. But to have something that has this level of evidence in a randomized controlled human study from scientists that we respect is phenomenal, to be able to advise patients to use this. So it's really game-changing for dermatology.
It's game-changing. And also the other thing to remember about these studies that they're done in a blinded manner. So the individual looking at the readout, which is under the microscope, they don't know whether sample A is from, retinoid-treated skin, or it's the untreated skin, or it's the skin that's been treated with night repair therapy. They just read it as they see it.
So were they surprised when they got them back and they were saying, "Oh, I actually expected this to be the retinoid"?
Yeah, definitely.
Wow. Yeah. So the question is, how do you get that message out there?
It's difficult because
you're upsetting an apple cart in some ways, because we've got this whole sort of.
Well, I think the thing is, and we touched on this again earlier on, is that there's still scepticism out there about this whole business. Because, and it's unfortunate that the research on aging has been sort of subsumed into, rather sort of pseudo-science aesthetics. And I think that we need to separate what's been going on in Manchester and other big centres from what's going on in more commercially minded enterprises. Now, we were after the truth, the facts. If it didn't work, it didn't work. That's just the way it is. But this did work, and then it's our role to try and understand how it works. And this is completely different.